We enrolled a population of patients with relapsed and refractory follicular lymphoma in a phase II trial with Tisagenlecleucel. And the primary objective of this study was to look at the overall response rate, the complete response rate of the drug in these relapsed patients. The eligibility criteria really just included patients that had relapsed or refractory disease, and we excluded patients that had transformed lymphoma. We enrolled several patients. We enrolled 98 patients. 97 were infused, and we were able, at least at this meeting, I'll be reporting the efficacy on the 94 patients that were evaluable. And with that, we saw a very impressive overall response rate of 86% with a CR rate of 66%. At the at the current follow-up, which was 11 months, we have not yet hit a median duration of response. The probability of a responding patient to remain in response more than 6 months was 79%, and many patients actually converted from PR to CR, and that usually occurred between month 3 and month 6. So we're very excited about a very strong signal with regards to efficacy and in these patients who have often pretty refractory disease. And we noticed that this efficacy, or this complete response rate, appeared to be consistent across several subgroups that we looked at, including patients that had early progression from first-line therapy. These are the POD24 patients, prior stem cell transplant, as well as patients who had prior PI3 kinase inhibitors, as well as, again, patients that had multiple lines of treatment up to over 4 lines of therapy. Those patients all tended to have fairly similar response rates in the 80% range. In the trial, we also looked, obviously, at adverse events. Not surprising, we saw adverse events in pretty much all patients. These are all grade. About 77% of patients had adverse events which were suspected to be drug-related. 76% of the events were grade 3 or 4, and around 45% of patients had a grade 3-4 event which was suspected to be related to Tisagenlecleucel. We did see some cytokine release syndrome, although no patient, 0, had a grade 3 cytokine release syndrome. And we only saw 1 patient with a grade 3 neurologic adverse event. We did see some cytopenias, including neutropenia and anemia, that occurred grade 3 in 27 and 13% of patients. Very low levels of thrombocytopenia, only 9% had grade 3 or 4 event. We saw some patients who had prolonged depletion of B cells, as would be expected with CAR T-cell therapy, although there were no patients who had prolonged depletion of B cells that were grade 3 or greater. We also looked at the management of cytokine release syndrome, and 34% of patients, 16 patients, received tocilizumab, and 6% of patients had corticosteroids. We only observed at this report 3 deaths. None of these were due to CAR T-cell. All of them were due to progression of the underlying disease.